Okay, I'm Brittany. I'm going to be presenting breastfeeding to you. I'm a nurse. This is my mom, and I'm going to be talking to her about breastfeeding. And she didn't breastfeed me, so she has a need to know. So, some of the benefits for the baby is the first milk that comes is colostrum, and it's thick and yellow, and it's rich in nutrients and minerals that are needed along with antibodies. It provides the baby's immune system. By the third or fifth day, mature milk comes in, and it has the right amount of fat, sugar, water, and protein in it, but it's thinner than colostrum. Breast milk is also easier to digest. Formula contains proteins from cow's milk, which is harder for babies to digest. It also contains cells, hormones, and antibodies. It protects the babies from ear infections and diarrhea, which are the two most common causes of problems with babies, but it also protects them from necrotizing enterocolitis, where their bowels basically die. Lower respiratory infections, asthma, and type 2 diabetes. Some of the benefits for mom are there's no nipples to sterilize. It saves money. It provides bonding time. You have a healthier baby because you breastfeed. And it also lowers the risk of type 2 diabetes for mom, along with breast cancer, ovarian cancer, and postpartum depression. So, there's a guide to breastfeeding online at womenshealth.gov, and it comes in a magazine like the one pictured, and it basically gives you steps and gives you how to, and all of my information came from there. After birth, they're going to do the Apgar, they're going to weigh the baby, clear all the secretions, and they're going to place the baby on your chest. And they want you to breastfeed if you are going to breastfeed. They want you to breastfeed as soon as possible. But we also want you to consult with a lactation consultant, and they should be able to help you with any problems or questions. Also ask the staff not to give the baby any formula or pacifiers or artificial nipples, so that they can learn that when a nipple is nearby, they're going to receive sustenance from it. Allow the baby to stay in your room as long as possible. And avoid giving the baby a pacifier or an artificial nipple. And then when you're getting the baby to go to your breast, you lay the baby on your chest with just a diaper on it, and then you can guide the baby to your breast, and there are different positions you can hold them in, but whichever works best for you is generally what is best. Best for you and the baby. Support the neck and the shoulders with one hand and support the hips with the other hand. The baby's head should be tilted back slightly. When their head is tilted back, their tongue lays down in their mouth, so their mouth hangs open. Allow your breast to hang naturally. And the baby can actually breathe while breastfeeding because their nostrils flare. And the baby may latch on by themselves. So they may automatically just go there. If you have problems, you can tickle the baby's lips with your nipple. You can pull the baby close so that the chin and the lower jaw moves onto the breast first. And then watch the baby's lower lip and try to aim it as far from the nipple as possible. And signs of a good latch is it feels comfortable, which it might not at first. It probably feels weird, but as time progresses, it should feel comfortable. The baby's chest is against your body. The baby does not turn their head while drinking. Little or no areola is seen. The baby's mouth is filled with breath. You can hear or see the baby swallow. The baby's lips look like fish lips. Yeah, and the baby's chin touches the breast. And we actually have a little baby, but you can't see the demonstration with the camera. So we'll pass that. And then there's my reference where I got it. And that's it. Do you have any questions?
No, it makes me wish I had breastfed you.
Oh, okay. Well, it's okay.
It wasn't explained to me that well.
Oh. Well, there are better things now, though.
Right.
Yeah.
Okay.
It's okay.
It's okay.
All right.
You turned out pretty good.
I don't know. They say things about me.
They're not true.
Oh, okay.